I used to think joint pain was just one of those things that came with getting older, like reading glasses or forgetting why you walked into a room. My knees started complaining in the mornings, especially when I got out of bed. A little stiffness here, a bit of soreness there. I didn't think much of it, but slowly it got worse. Sitting too long made my hips lock up. My fingers began to feel like rusted hinges. Bending to tie my shoes felt like folding a stubborn old deck chair. I went to my doctor, like anyone would. He barely looked up before saying, "Sounds like arthritis." I nodded. It made sense, I suppose. I was in my 70s. Isn't that just what happens? He handed me a prescription for anti-inflammatories and told me to stay active. I left the office feeling like I had been handed a label, not a solution. Still, I took the pills, like a good patient. The pills didn't do much. The pain dulled a bit, but it never left. And on some days it flared up even worse. So I tried everything I heard on the news or from friends. Glucosamine, turmeric, collagen powders. At one point I had more bottles in my cabinet than my local pharmacy, but none of it helped the way I hoped. I started to think maybe this was just my new normal. That thought was the most painful of all. Then, during a visit to see my son, his wife mentioned her physical therapist. "You should see her," she said. "She's helped people your age walk again without pain." I was skeptical, but I went, mostly to humor them. That first session changed everything. She didn't mention arthritis once. Instead, she asked questions no one else had. When did it start? What makes it better? Where exactly does it hurt when you move like this? Then she gently pressed on a spot near my lower back, and I nearly jumped. "That's not your knee," she said softly. "That's nerve pain from your spine." Turns out my so-called arthritis wasn't arthritis at all. It was a misdiagnosed nerve issue, something called spinal stenosis. My back was pressing on a nerve, and the pain was radiating into my legs. The treatment I needed wasn't more painkillers or joint supplements. It was gentle stretching, posture adjustments, and a plan to relieve pressure off my spine. I felt both relieved and a little angry. All that time I had been treating the wrong thing. No one had lied to me outright, but they hadn't told me the whole story either. And I had paid for it. In time, in money, and in daily discomfort that could have been avoided. After I learned about the spinal stenosis, everything I thought I knew about joint pain began to unravel. I started looking back at conversations I'd had with friends about our knees, our hips, our aching backs. We had all blamed arthritis, as if it were some inevitable punishment for reaching a certain age. But what if some of us were wrong? The physical therapist showed me how my body had been compensating for the pain in ways that made it worse. I had developed habits, small ones I never noticed. Leaning to one side when I walked, favoring one leg when I stood, sitting in a way that compressed the same area over and over. These things, over time, weren't just side effects. They were part of the cause. She introduced me to movements that seemed absurdly simple. Lying on my back, slowly drawing one knee to my chest, or pressing my foot gently into a resistance band. At first I thought, how could this possibly help? I had been swallowing capsules the size of almonds and rubbing on creams that smelled like old libraries. Surely this wasn't enough, but within a few weeks, something shifted. Not overnight, not dramatically, but I noticed I was standing up straighter without realizing it. I could get out of a chair with less bracing. The ache that had made mornings so unbearable began to dull. And then came the real surprise. I slept better. I hadn't even connected my pain to my sleep problems. But once my legs stopped tingling at night, I could stay asleep longer. I wasn't waking up every hour to shift positions or walk it off. For the first time in years, I felt like I was repairing instead of just enduring. I began to read. Not deep medical journals. I'm not that ambitious, but enough to understand something important. That doctors often default to arthritis as a diagnosis because it's easy and statistically common. But that doesn't make it the truth for every person. There's a difference between treating age and treating you. No one had looked at my gait. No one had checked my spine. No one had asked if I had numbness or tingling or if the pain changed with posture. They had all assumed that being over 60 meant arthritis by default, and that mindset cost me 2 years of my life. Now I tell my friends to ask more questions. Not in an angry, mistrusting way, but with curiosity. Could it be something else? Is there another reason this hasn't improved? Not all doctors lie, but many don't tell you the whole truth unless you ask for it. Sometimes they just assume we won't understand, or that we won't want to know. And that's the part that still bothers me. How easily older patients get brushed aside. As if our pain is just something to be tolerated. As if comfort no longer matters once you hit 70. The more I learned, the more I realized how many others were in the same boat, drifting in a sea of vague diagnoses, generic pills, and polite nods from busy doctors. I wasn't alone. That was both comforting and upsetting. Comforting because it meant I wasn't imagining things. Upsetting because it meant the problem was bigger than just me. I started talking to friends at church, at the senior center, even neighbors I hadn't really spoken with beyond small talk. I brought it up gently, just mentioning how I'd been misdiagnosed, how my pain turned out to be from something else entirely. Every time I saw that same spark in their eyes. Hope, maybe, or recognition. One woman said her shoulder pain had been blamed on wear and tear, but no one had checked for a rotator cuff injury. Another man told me he'd been on arthritis meds for 5 years, only to find out later that the real problem was poor circulation from diabetes. It felt like we were all characters in the same quiet tragedy. No screaming, no drama, just the slow erosion of mobility and the quiet acceptance of discomfort. We live in a world that says age gracefully, but what they really mean is suffer quietly. Don't complain. Don't ask too many questions. Just accept that your body is fading, and be grateful you're still here. But I don't think that's grace, that's neglect wrapped in politeness. My physical therapist, God bless her, kept reminding me that pain is a message, not a sentence. It's the body's way of saying something isn't right. And if we treat every message the same way, we miss the real meaning. She helped me understand patterns in my own movement, posture, and habits that had built up over decades. She explained how the body, when misunderstood, starts to protect itself in ways that backfire, like tightening muscles around a weak joint, which leads to more stiffness, or walking differently to avoid pain, which creates imbalance and new pain elsewhere. It's a cycle, and unless someone looks at the whole picture, you stay stuck in it, treating symptoms that aren't the root. I began to shift how I approached my own health. I stopped looking for the next miracle pill and started paying attention to how my body responded to different movements, foods, even moods. I noticed how certain chairs made my back worse, how drinking more water actually eased some of the aching. Small things, nothing dramatic, but they added up. And most of all, I stopped assuming pain was my fault, or that it was just something to endure. There's a difference between growing old and growing ignored. I had spent too long believing I was just unlucky or fragile. Now, I was starting to believe something else entirely, that I deserved to feel better. Not just survive, but move through life with a little less struggle. It's funny how once you start listening to your own body, it talks back in ways you never expected. I began to notice patterns, subtle ones. If I walked barefoot too long on hard floors, my knees would ache the next morning. If I sat through a long phone call slouched on the couch, my hips would whisper their complaints for hours. But if I stood up every 30 minutes, if I stretched even just a little before bed, something shifted. The pain stopped screaming. It became quieter, like a background hum instead of a sharp stab. I don't think doctors are bad people. I really don't. I think they're busy, overloaded, and taught to solve problems quickly. A 70-year-old with knee pain? Boom. Arthritis? Case closed. Maybe it is sometimes, but maybe not. And that maybe not can cost someone their independence, their sleep, or even their dignity. What hurt the most wasn't the pain. It was the way no one seemed curious about it. That's what I learned to value most. Curiosity. The willingness to pause and ask, what else could this be? My physical therapist had that curiosity. She didn't see me as a checklist. She saw me as a puzzle and treated me like a person worth solving. It reminded me of how we used to fix things when I was young. If your tractor made a strange noise, you didn't just pour oil on it and walk away. You listened. You checked the gears, the belts, the parts underneath that no one sees. Bodies are the same. Age doesn't make them less worth understanding. I started writing things down. Not because I planned to publish anything, but because it helped me see the connections. I wrote how I felt after eating certain foods, how my legs responded after walks, what the weather did to my joints. The little notes became a kind of map, a way to navigate pain instead of just being carried by it. I also began to speak up more. At follow-up visits, I asked questions. I pushed back when answers were vague. I didn't accept "it's just your age" as a conclusion, because that's not a diagnosis, it's a dismissal. One day, I even brought my notebook to the clinic. My doctor looked at it and said, "This is more detailed than most charts we have." I smiled politely, but inside I felt something shift. I wasn't just a patient anymore. I was a participant. And that, more than anything, changed how I healed. I wasn't waiting to be rescued by a pill. I was learning to rescue myself, piece by piece, question by question, until my pain finally had a name. And more importantly, a way forward. Now, when I sit with others my age and hear them talk about their pain, I listen differently. Not as a fellow sufferer, but as someone who's seen the other side. I don't offer advice unless they ask. I just share what I learned. That pain isn't always what it seems. That arthritis isn't a catch-all truth. That sometimes the fix isn't in a bottle, but in the way you stand, the way you move, or the way you've been carrying your body for decades. Sometimes they nod, sometimes they change the subject, and that's fine. Not everyone is ready to question what they've been told. Especially when that story has been repeated so often, it feels like fact. But once in a while, someone does ask, and I tell them everything, not just about spinal stenosis or stretching or habits. I tell them how it felt to be heard, to be treated like my pain mattered. I tell them how long I lived thinking this was just the price of aging, and how liberating it felt to find out that it wasn't. I used to think healing was something doctors gave you. Now I think it's something you participate in. They might offer tools, but you have to be present. Curious, willing to ask more, willing to keep trying. I still have pain, of course. I'm not 20, but I know where it comes from now. I know how to manage it. I know when to rest, when to move, and when to speak up. That alone changed everything. There's something powerful about reclaiming your body after years of believing it was failing you. Mine wasn't failing. It was just trying to tell me a story I didn't yet understand. And when someone finally helped me translate that story, I didn't just get relief. I got clarity. So if you're watching this and you've been told your pain is just arthritis, ask again. Ask differently. Ask until the answer makes sense not just to your doctor, but to you. Because you live in that body. You wake up with it. You go to sleep with it. You deserve to know the truth about what it's trying to say, and maybe, just maybe, what's hurting you isn't what they said it was. Maybe it's something fixable, something reversible, something that still has a path forward. No one should be made to feel like pain is just their new companion for the rest of life. Not when so much of it can still be changed. Not when so many of us are still willing to listen, to learn, and to live with less pain. Even now, even here, even after 60, 70, or beyond.